Good morning, class. We've covered diabetes mellitus extensively, and today I want to quiz you to ensure you've grasped the essentials. Let's start with the basics. What is diabetes mellitus?
Diabetes mellitus is a group of diseases that affect how the body uses blood sugar, or glucose, which is a key source of energy for cells and the brain. All types lead to excess sugar in the blood, which can cause serious health problems.
Excellent, Scarlett. Now, what are the different kinds or types of diabetes mellitus?
The main types include type 1 diabetes, where the body doesn't produce insulin; type 2 diabetes, the most common, where the body resists insulin or doesn't produce enough; prediabetes, with higher than normal blood sugar but not full diabetes; and gestational diabetes, which occurs during pregnancy and may resolve after birth.
Very good. Can you give me more details on how type 2 diabetes works, John?
In type 2 diabetes, cells become resistant to insulin, so glucose can't enter them effectively, leading to high blood sugar levels. The pancreas tries to produce more insulin but eventually can't keep up, often linked to factors like obesity.
Correct. Now, what are some common symptoms of diabetes mellitus?
Professor, common symptoms include increased thirst and frequent urination, unexplained weight loss, fatigue, blurry vision, slow-healing sores, irritability, and frequent infections like skin or vaginal ones. Symptoms can be more severe and sudden in type 1.
Excellent, Scarlett. Well done. Early recognition is crucial. What about the primary causes or risk factors?
The main types include type 1 diabetes, where the body doesn't produce insulin; type 2 diabetes, the most common, where the body resists insulin or doesn't produce enough; prediabetes, with higher than normal blood sugar but not full diabetes; and gestational diabetes, which occurs during pregnancy and may resolve after birth.
Spot on. Many are lifestyle related. Let's move to treatment options. What medications are typically used?
Professor, for type 1, insulin therapy is essential, delivered via injections, pens, or pumps. For type 2, oral drugs like metformin are often first, along with others to improve insulin sensitivity or reduce glucose production. Insulin may be needed later.
Excellent coverage. Prevention is better than cure. How can we prevent diabetes mellitus?
Professor, for type 2 and prediabetes, maintain a healthy diet, exercise at least 150 minutes a week, lose weight if needed, avoid smoking, and manage stress. Regular screenings help catch it early. For type 1, research on immune therapies is ongoing.
Excellent, Scarlett. Absolutely. Finally, what hospital equipment or tests are used to diagnose diabetes mellitus?
Diagnostic tests include the A1C test for average blood sugar, fasting blood sugar test, random blood sugar, and oral glucose tolerance test. Equipment involves blood glucose meters, continuous glucose monitors with skin sensors, and lab analyzers for blood tests. Urine tests for ketones in type 1.
Outstanding, class. You've demonstrated a strong understanding of diabetes mellitus from definition to diagnosis. Remember, managing blood sugar through lifestyle and monitoring is key to preventing complications. Keep up the great work.
After watching the video, answer the following questions. 1. What is diabetes mellitus? 2. What are the different kinds or types of diabetes mellitus? 3. Can you give me more details on how type 2 diabetes works? 4. What are some common symptoms of diabetes mellitus? 5. What about the primary causes or risk factors? 6. What medications are typically used? 7. How can we prevent diabetes mellitus? 8. What hospital equipment or tests are used to diagnose diabetes mellitus?
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.